1 in 8% of children actually have food allergies. Many people in the past, if you were born as a potential allergic person, a Th2 person, if you were exposed to bad things early in life, things like malaria, tuberculosis, measles, rubella, hepatitis, then your immune system had to change and become a Th1 fighter to save your life. So when it did that, a lot of patients who were born with the potential to become allergic suddenly lost that allergy. And so there was a Th2 to Th1 switch, and that switch made people less allergic. Now, because as an unintended consequence of much better health, of good hygiene, and of good care, many people who are born allergic now stay allergic. The latest recommendations from the Academy of Pediatrics and Academy of Allergy too is that children, when possible, be breastfed for at least 4 to 6 months' time. And that's a pretty good standard. And that doesn't prevent all allergies, but it may help in a huge number of ways, preventing ear infections, bronchitis, asthma, and decrease the incidence of allergies. Once you start adding foods in, again, somewhere in that 4 to 6 month range, typically we'll start with what we consider to be the least allergenic foods. Things like rice in particular, applesauce, sometimes things like oats, corn, wheat, soy are usually ones that we add in. We typically are going to wait at least into a year before we add in the highly allergenic foods, the things such as peanuts and tree nuts, although we'd never give a nut to a child, but whether we'd give almond butter or things like that, and eggs and fish. And again, most importantly, add in one at a time and giving the child a few days to see if they tolerate it, and make sure if there is any hint of a problem. If the child breaks out in a rash or gets a little bit of hives, then that's when you want to stop, step back, not give for a period of time, and in fact you want to talk to your doctor about that, because that's where we'll sometimes get a hint of a child who's eaten a little bit of peanut butter once and broke out in a little bit of a rash, and no one quite recognized it or didn't tell anyone, and they tried it a second time, and that's when they had a more severe reaction.